Hello, Kiran sir.
Hi, Vikalp. Morning.
Hi. Good morning. Good to see you. So, thanks, sir, for joining. We'll start. Welcome, everyone. I hope you had a good long night of coding, innovating, developing, and building some really cool stuff. And welcome today. It's the last day of Hackathon, and it's our privilege. It's my privilege to have Kiran sir join us for the morning keynote session. And Kiran sir needs no introduction, but it's my privilege to introduce him. Kiran sir serves as a joint secretary of at National Health Authority and also a mission director of Ayushman Bharat Digital Mission. The APIs and the mission that we all spoke about yesterday, and we were all building innovation on top of it. Sir, there was a lot of excitement around ABDM, which was really heartwarming to see. Sir is an accomplished alumnus of IIT Bombay, and he brings a lot of technical and strategic leadership to the whole health mission that we have been seeing over the last few years. Today, we see more than 350 to 400,000 scan and share happening every day across the various healthcare facilities. This has all happened in Sir's leadership. Also, personally, I have been inspired quite a lot by my interaction during my interactions with Kiran sir. His deep insights on insurance space that we were speaking about yesterday around NHCX and how the whole ABDM and insurance come together and solve for the larger good has been quite fundamental. Uh, all my conversations with him has actually shaped up the way Eka thinks about ABDM and health in general. More importantly, Kiran sir also looks after PMJ, which is what again we spoke about yesterday. It's the largest insurance scheme in the world, with more than I think 550, 600 million people coming in the ambit of PMJ, and it's growing leaps and bounds now. Sir has been like taking the charge of all of that with great rigor. Welcome, sir, here. We did this hackathon to make sure that we sort of create even more innovations around the digital health sector. We had close to 40 teams. They registered for the hackathon. We got some 15 teams to finally come and present to us. Today, we will close all of these innovations, and then there will be a judging round where we will judge. I'll also share with you a complete report of how it happened and all the innovations. Many of us were actually looking at ABDM APIs, so there will be some innovations that we definitely would have on that. There are key judges who would be coming in to judge, including Raman sir from NHA, which is again our privilege. Uh, Also, I think your kind words would definitely motivate us, inspire us, and looking forward to hear you, sir. Thank you.
Thank you, Vikalp. And first, I must congratulate you for being one of the they call pioneers of taking this digital health forward in the country. And Eka Care has been, one of the valuable partners with NHA in taking this digital health initiative and the mission forward. And the hackathon that you're organizing is a testament to your efforts and your team's efforts to taking this initiative forward. And having 40 teams sit there and work on ideas, and I was just going through the schedule that you have prepared for yesterday and today, and also, the submission date I think was what, May 30th. The deadline was, and I was following it actually on your webpage because I was very keen on understanding what's happening and what useful things can really come out of this. So, thank you for inviting me for interacting with you all on this. So, as you all know, the Ayushman Bharat Digital Mission, earlier called the National Digital Health Mission, has now entered its fifth year. And in a way, what we have done is in the early years, the first 2.5, or even 3 years, I would say, was a time when we were trying to stabilize or rather build the tech part itself. I mean, initially we had to launch a pilot, so we did something, and then later on we onboarded a full-time MSP to do it, and then we had version 1 of APIs, version 2, and version 3. And I'm told version 3 is now relatively stable. We will continue improving upon it. But what I mean, what I would like to highlight here is that we are at a stage where we move from that tech-focused stage to more adoption and innovation-focused stage. And that is exactly where we need to look at a holistic perspective of how digital health, I mean, how ABDM and other digital tools that are getting created as part of this entire effort can come together to give a holistic view of the health system itself. And something as simple as connecting the different systems that are running, different programs that are running in our country. Like even in the government level, you will see there is a primary health team or a primary health program that runs, and there are hospitals at the primary level which are called the community health centers, primary health centers, or the what we call the Ayushman Arogya Mandirs, who are providing the basic care. And then at the other end, you have secondary and tertiary care hospitals in the government domain. And PMJY also brings in the private sector by way of empanelment. But then what is happening is, in fact, we are currently evaluating what we have done under ABDM and what we should be doing for the next 5 years. So when we go back and read the original approval or original thought process of what ABDM was supposed to bring, so it looks like we have been able to achieve some outputs. I mean, the numbers that Vikalp mentioned about the number of scan and share happening every day, the number of ABAs. We've created close to 77 crore ABAs now. More than close to 60 crore records have been linked with the ABAs. But I think from output stage, we need to look at outcome stage. So this is where the application of all the APIs, all the systems can come in to solve problems. See, effectively, what the mission or the objective state, the vision statement of ABDM is to create a digital health ecosystem that can support universal health coverage by leveraging open API standards and systems while ensuring data privacy and security. So, I mean, the idea is what is the benefit or what is the advantage that we are giving to the citizen? What is the benefit or advantage that you are giving to the provider? Because we should not forget the provider, the doctor, the hospital in this. So the solutions that you are coming up with, the solutions that you are building today, I'm sure will help us go a long way in addressing that part. So you are actually helping us come up with the outcome part of the ABDM and also the larger digital health initiative in the country. And one more important thing I want to highlight is right from the very early days or when ABDM started, we did not start it as a government program. I mean, it wasn't like government will build everything, come everybody start using it. Partnership with the private sector and private sector innovation is a very, very important factor, and that is something we hold very dear and sure. And we always value the partnership with the private sector, and that is where Vikalp and other digital health partners come in. And the innovation that you are doing, the new ideas that you are bringing in are the ones that are driving the digital health ecosystem forward. So basically, the idea is that through this Ekathon and also through other efforts, how do we take the country forward and build an ecosystem that is connected, where we are able to integrate the data that is coming from various sources. It could be, like we always say, public hospital, private hospital, health lockers, PHR applications, wearables, and other devices. How can we then give a holistic, overview to a citizen of his or her health status? How can we give a holistic view of a patient's health status to a provider so that they can give better care? And then how can this entire data be utilized for better policy making? An example I can give you, very simple one, is today Eka has immense number of what you call PHR users. Similarly, there are other PHR applications. We are estimating that there could be anywhere between 9 to 10 crore app downloads and app users today. So we all know there is, there is this talk of COVID cases coming here and there, and we are also now closely monitoring it. I don't think, and I really hope that it doesn't go to a level where it becomes a bigger issue. But the thing is, because now we have the PHR apps in so many hands, as a matter of fact, the disease surveillance becomes much more simpler if information from all the PHR apps is collated in an anonymized manner, of course, without the personally identifiable information, and that information is used to track what is happening. We move a little forward from it, or move a little ahead from it, and say AMR and antimicrobial resistance is a very, very important issue these days. I mean, people are popping antibiotics like peppermint, and as a result, the viruses are and they are actually becoming more and more resistant. And after a point, sometimes what happens is people are using all these antibiotics over the counter in such a free way that when they really fall sick, when it really matters, every antibiotic is failing. So this is a big problem. But again, with the connected system, with the data that is getting collected of prescriptions, of lab tests, if we are able to build a system where we are able to look at this data related to antimicrobial resistance, that is very much possible because of the digital health system that has been created, if we are able to connect all of them and integrate that information. And another example I can give you is prescription of drugs that are controlled. We all know there is a category of drugs called category X, Schedule X drugs. These are those narcotics and psychotropic drugs which should be prescribed only by a particular type of practitioner who has the permit, and only through those special medical shops where they have to be done. Now, efforts are on the pharma side to say that, okay, we will try to regulate it, etc., etc. But what best way is there other than to look at it from a digital health prescription that is coming, and that is coming onto a PHR application that is getting connected to an ABHA, that is being delivered by a particular doctor with an HPR ID, so that we know who's actually prescribing these drugs. So the potential is immense. The problems we can solve are numerous, and the solutions and the problems that you have posed and you are solving today, I'm sure will actually add to this wealth of possibilities that are possible under digital health. And then another aspect is about how do we take our own digital health data in a more meaningful manner. So as a PHR application, how can this data help a citizen maintain better quality healthcare? How can it actually transform into nudges? There is a diabetic using a PHR app, and we are able to also capture the wearable information, and also the HbA1c and other test information, and also the drug information that he's taking. Compare it with similar population groups, and then give him nudges based on AI-based systems. Similarly, using this entire information to provide him and to help him find better insurance through the claims exchange and other tools that are being built. So, there are lot of opportunities, lot of ideas, and I'm 100% sure. You are a very, very smart bunch, and I'm sure you would have thought much more than what I have mentioned. And these 40 teams, the solutions the problems they are addressing, and the solutions they'll come up with, I'm sure will go a long way in enriching whatever we have done so far in building the digital health. What I can also tell you is, we are, as we move to the next phase of ABDM, where we have to plan about what we do until 2030. We are calling it ABDM 2.0. So while we build the strategy, I think what comes out from events like these, what comes out from hackathons like these, will actually also help us understand the way forward, and also identify what best NHA can do in order to support these solutions even further. So, in fact, we are coming to Bangalore 2 weeks from now, where we will also be listening to all the private sector partners there to take this forward. But as far as the Ekathon is concerned, I think once the Ekathon is completed, once the solutions are identified, I think we will definitely work with the Eka team to see how we can take them forward, how we can help them scale up, and how we can actually, if there are good solutions, which I'm 100% sure there will be, how we can actually take you through the right channel so that you are able to scale it up and scale it up and take it up to a level where they start becoming national scale applications and become commercially viable. So I can assure you that we will ensure that we take this forward. We work with Eka on taking the solutions forward and see how we can foster the innovation further and take whatever solutions are coming out of this to a next level. So, I mean, I'm sure you would want to get back to your coding and start working because you are on a tight schedule. I thank again, once again, Vikalp and his entire team for organizing this. And I thank all of you for coming, showing interest and coming and participating in this. And I really look forward to the results that come out, and I really look forward to the solutions that you are building, so that we can use them, we can take them forward, and we can scale them up. Thank you once again, and wish you all the very best in what you're doing. Thank you so much.
Thank you so much, sir, for these inspiring words. Some of the takeaways that I have from this keynote is now is the time from output to outcome, which is fundamentally very important. And I think it's very well articulated. And we have seen that journey also in the last 3-4 years. There has been so much changes, so much reliability, so much optimizations, new features that has come up, which should go to a large scale adoption that should result in an outcome. And thank you so much for sharing many of these innovation. And just to add to what Kiran sir said, Eka got a lot of benefit, and thanks to NHA and ABDM, we as a company, we were able to scale our product to the millions and millions of users, thanks to the initiative that Government of India has taken. And we are one of the large beneficiary of this. And when sir was talking about that government's job is to bolster this innovation, we have seen that over the last 3 years. So the innovations that you are building, if they are public scale innovations, be it PHR apps, be it for doctors, be it for nurses and anybody else in healthcare, I can assure you that NHA can take you to a really, really long and to many users. So thank you again, sir, for that. Maybe if you have like 4-5 minutes of time, if there is any question, maybe one or two that you want to ask, sir, we can have one question from anyone. Anybody wants to? Yeah.
How is the government looking at AI's role in public health over the next 5 years?
I can't hear him.
I'll maybe repeat. So the question is how government is thinking about AI and public health, and how that will basically transform the public health and AI. And yeah.
Thank you for the question. I think government is seized of the matter that introducing AI in healthcare is imperative. Simply because of the ease of use, simply because of the fact that it is the best way to go forward in terms of utilizing the reams of data that we are creating, the large amount of data we are creating. And more importantly, AI seems to be the way to go forward to bring about more adoption. I mean, simple, again, an example or an experience that we've been having over time is expecting doctors to type and create a health record has been very tough. And I don't think going forward it's sustainable. So that is where I mean, an AI-enabled solution, like even like I'm sure you would have been working on Eka Scribe tool as part of your Ekathon here. So tools like these are the ones which will bring or make it easier for professionals to start using digital solutions. And then similarly, AI tools are also required to ensure that the data that is getting collected actually gets converted and analyzed for better outcomes. Like I mentioned, the diabetic patient example, I mean, giving understanding the patient's situation in real time by comparing it with similar data and then by identifying what is the nudge. Like, for example, I'll tell you, if you are a PHR app, if you're developing an app, let's say, for example, I was having this conversation with some students yesterday, where they said, okay, we have developed an application for the citizens and we give them a lot of information and we try to tell them what are the health behavior. I said, if you are actually able to use AI or other tools in a better way, you will actually be able to tailor that information in a way that suits the person. Like if it is a general notice, after a point, people will start ignoring it. If it is not related to me, I mean, why do you read a particular news item when you scroll through the Google News? Or why do you read a particular notification when you have so many notifications come to you? So tools that are AI enabled can actually help tailor notifications, tailor the nudges that we want to give them that to their context, to something that is more relevant for them. So that way you will make your application more engaging. And that is how you retain your user base. That is how you keep them interested. I'll give you an example of what I heard some time back when we were preparing for the UPSC exam. One of the what you call papers in the exam is an essay. You're expected to write an essay, and the topic could be anything. And of course, in the examination hall, they'll give you like three or four topics, and you have to write an essay. So the one person told very, very wise thing about an essay. He said, your essay should leave the reader with a feeling like reading again. You should give him, that is the hook that you're creating. Similarly, AI can actually help you create those hooks so that you as a product developer can create a product that citizens like and are able to use it further. So from a product developer point of view, that is one way you can look at. And the other way is like making life easier for the poor health worker. An ASHA who is working at the field level, who gets just a very little amount of money in terms as an honorarium, is expected to use multiple portals. Imagine if we can use AI to make her life easier, that she's entering data in one place, it gets automatically uploaded somewhere else, or she's getting summaries that are better and she's able to use her time in actually providing healthcare and doing the survey and doing the counseling to the patients rather than working on a solution. So government is very much interested and government thinks introducing AI is the way forward, and that is why we have just recently developed a AI benchmarking platform with IIT Kanpur. So if you have an AI solution, you want to get it evaluated, this is a platform that we will use to use public data, the data that we are creating under ABDM and PMJY, to benchmark that solution, and then you will be able, the certification process of any solution, or what you call solution as a device, becomes quite faster. So government is very much with you in any AI solution which you build, and I think we are very interested in seeing more and more solutions and taking it forward.
Awesome. AI is a flavor of the town, and as you rightly said, sir, there are teams who are building solutions on top of Eka Scribe, but they are taking it to the next level, where Eka Scribe and the other models, they are all coming together to finally provide the solution. But thank you so much for your valuable time. You're very busy, and thanks for taking out your time and overshooting as well. Thanks again, and we'll share with you more details of how the Ekathon is going. Thank you so much, sir.
Thank you, and all the best to everyone.
Sure. Stop streaming. announcement to closure is a calm condition.